It's a beautiful morning. It's clear blue skies, and
Wait,
uh,
did you move?
no, I live in Chimicum.
Okay, got
I
it.
always have.
I
Yeah,
wasn't sure where, I'm never sure where the border for South County is.
I don't know either, but I feel like Chimicum qualifies.
Okay.
She's
And
making.
I'm like on center, like almost near the Quill scene, like 104. But I don't know. Where do you guys think South County starts?
Well,
Is
we've
it more,
had Quilcene and Brennan in
hmm,
there, but it isn't like we've had any participation outside of you from Chimicum on this group. But this
maybe
group
it's
is
a state
also,
of mind.
say again.
It's a
Maybe
state
it's
of
more a
mind.
state of mind.
I'm in the third district. I'm in Greg's district, so I feel like that makes me in the South County, the county commissioner district.
That's awesome.
Yeah. Bad internet.
Have you been down to Brennan since the drug take back?
No, I have not.
Um, well, I'm going to give it a couple of more minutes. I don't want to waste anybody's time if we don't have somebody from South County on here.
Nice to see your baby and you, Holly.
Good to be here. And thank you so much for running Drug Take Back on the 28th with Sheriff Knoll. I appreciate it very, very much. And
No
sure the
problem.
community did as well.
Yeah, no problem.
How was it? Did we get much in the way of engagement on that?
It wasn't super well attended. I think I should have reached out to Holly or let other people a little bit before and maybe done some like paper postering. And then we didn't, I know in the past, I'm not sure if Holly made it or if the fire station had it, but we had like a sandwich board that we had put out at the road and I didn't have that. So I think that there were a few like outreach things that could have helped engagement, but I had a nice time with Gabby and the sheriff, and two people came, but they didn't mean to come. They were just like walking by and we're like, this is what we're doing. And then they like came back and brought us stuff. And then another person came. So it wasn't as much engagement as Quilcene had been, but I think that, Holly wasn't on maternity leave in the past and there had been a little bit more outreach. So I think given the limited people power, like it was fine. Yeah.
Well, maybe for the sake of this group, even as we're waiting to see if other folks are able to join, how is it going on the Naloxone emergency boxes?
Pretty good. We have all of so we update for everyone. We bought the 10 boxes maybe like 4 or 5 months ago now. And they all have been spoken for essentially, but they're not all installed yet. So we've got 4 of them up. They're up at the Quilcene Fire Station, the Brennan Fire Station, Recovery Cafe, and Port Hadlock Library. Brennan maybe is having trouble getting theirs installed, so it hasn't been utilized as much, but the Quilcene, Recovery Cafe, and Port Hadlock boxes have all been restocked in like the month and a half that they've been up. I'd given people like 10 to start with and then said I'd bring more. So both Quilcene and Hadlock like Quilcene's had 10 and went through them, and then I gave them 10 more. Hadlock Library had like 16 and went through them, and I gave them 10 more. And then Recovery Cafe went through 10 and I gave them 30 as a backup. So they've also been running through them. And so then the additional locations are the Chimicum, Quilcene, and Brennan community centers. And there's just been a bit of a lag in communication and getting things up. We were working with Chris Goy, who passed away recently, to get those up. And I think some of the power shifts like haven't been super responsive to like the ongoing plan of getting them up. So hope to maybe pull Denise into it. I sent an email out earlier this week and no one responded, but I think Denise might respond to try to get the ball rolling, and she was CC'd on it. So that was kind of my next thought there. And then I need to follow up with the transit people because I have those boxes and I just need to deliver them to them. But they want them at the Haines Street station and at Four Corners. And that's 9 boxes, and that leaves the last box. I've met with Melody Sky Weaver, the director of the Port Townsend Library. She really wants to install a box there, but the Port Townsend Library is the city of Port Townsend. So now I'm in communication with Melody and the city manager, John Morrow. And Melody is very excited about it. And John, I think, just wants to make sure that there's kind of like a system in place, and but potentially doing a training for the city of Port Townsend employees, and a training for the Port Townsend Library employees, and then planning a training for the public. And I've already done one training at the Port Hadlock Library at the end of September, and that went really well and was well received, and they invited me to come back. And so I'm going to be doing a training there, I think on Thursday, December 7th, a second training there. So that's my box update. We've got 10 that are pretty much spoken for, and I still think if we could buy 5 or 10 more, that there's places throughout the whole county that more could go up. And I've been talking with John about potential places the city might want, like Mountain View Pool, where the YMCA and where the food bank are, and Water Street bathrooms, and the skate park, as far as Port Townsend goes. But I think there's more places across the whole county that could benefit from having that resource.
One of the places that was mentioned was to put one up at the Jefferson Healthcare Clinic down in South County.
Oh, cool.
And I know that the 10 that we've got are spoken for. Dunya, who would we work with if we were going to do that?
It'd be either Heidi or Cindy Cox, so I can put you in contact with those two.
Great, great.
And then can I ask another? I've been thinking about just sort of reflecting a little bit since we haven't met for a little while, and we were going to do the reflections thing anyways. That is, we postponed. And so, you know, lots of change I think has happened, and I think lots of good change. You know, like I thought transit, you know, I thought Greg had worked with the transit board to get more buses, because that was identified as a weakness to get access to healthcare. Working with Jefferson Healthcare sort of reopened the clinic in Quilcene that was not open, or I'm not sure, not open very often, but now it's open more often maybe. I'm sorry for my simple-minded point of view. But you know, so better access. You know, we now have cares in Quilcene with Gabby lending her expertise to them for more access. But on this board, we've always had we started with like leaders of the communities, you know, so the fire chiefs and the superintendents until the one retired. And I wonder, you know, then we had a community member from Quilcene join, and I think she had a lot of insight. Denise, I forget her name, who's a bus driver, and works at the community center, providing space for teens to do homework and do sort of engage each other thoughtfully and wisely, and she's mentoring a lot of teens. And we met her, I think, at the Love in the Time of Fentanyl screening, if I remember right. And I just wonder, is there an opportunity for more of a community member from Brennan? And Anya, I don't know, in your travels down there, or Gabby, if like, I feel like we have the leaders, but it'd be nice just to have like regular folk, because sometimes, you know, I think those are the people we need to make sure we're engaging, and it's just hard to know sometimes if we are. And I don't know if now is an appropriate time to talk about that, or.
Well, we definitely, as is shown today, we don't have anybody from South County on this call. And I don't know if that's just a matter of schedules, or if there's a general apathy about what is going on. And in all of the events that we've had down there, we've made an effort to connect with community folks. And so I'm interested if other folks have other people that they can suggest, ways that we could go about recruiting, so that we have more than the people who are often called to these other meetings and then can't be on the call. Holly?
I've run into actual connectivity capabilities has also been a reason for why folks haven't been able to join virtual spaces. Is the internet broadband is not great from a laptop or even cell phone perspective, and folks have to come into town to get reception in some places. So
Right.
I've run into that trying to get recruiting for
So it could be a
the
technical
Prevention
as much
Coalition
as
as
a
well.
bandwidth, right? Anya or Gabby, do you have ideas of folks that would be good voices to have at this table?
I don't really have folks in Brennan off the top of my head, no, but I agree that it would be good to have a few community members. What about you, Gabby?
To be honest, the people that I know in Brennan are struggling. I don't really know anybody else in Brennan. I'm happy to put my feelers out though and try to find some people out there that would have a sound mind to voice some concerns or opinions at this table. I think that it would be good to have community members at large be present, but I just don't know anyone.
Okay.
Yeah, I just wonder if it, even Gabby and Anya, if you encounter people with lived experience, either current or former, I think that could be also helpful. I'm just not sure if the perspective of one narrow echelon of the community can represent the whole community, or if it'd be better to have more variability. Because I thought, like, when we did the Love in the Time of Fentanyl, I think learned a ton and met some great community folks who were just surprised even, about how involved and passionate they were. So it was great. It broke down some of my assumptions about Coolsing.
So
If you make some kind of flyer, I'm happy to put it in the mobile clinic that has the information for this. If that's something you would be willing to do.
it's a great idea, Gabby.
I was gonna say Holly and I haven't checked in on one-on-one in a while because Holly just got back. But I know that we talked about last year after the Blake decision doing like a Blake decision follow-up because now there's a new law. So I'm wondering if that's something we'd want to look into for later in the winter or early in the spring or something, and just like doing more events down there to try to bring people out and let them know about our work and our coalition effort and things like that.
That's a great idea. All right, well, I'm going to write up a couple of notes just around this, look at creating some sort of a brochure. I'm not even going to set another meeting right now because I think we need to regroup and I don't want to waste people's time coming onto a call that isn't well attended. And so with that, any other updates or things that you'd like to share before I let you guys go? Dunya?
Back to that topic, it's probably Anya who would have the most knowledge about this. I had a meeting last week with Barb and your two epidemiologists, and they are doing qualitative research with Village Reach in South County, in-depth interviews with families down there. And I just wonder if this work dovetails into that, or Anya, if you know more about how that would inform this or not.
I don't know anything about that, but I can check in with them. And
I do.
Oh, there you go.
So Junia, I'm Holly. I'm also with Jefferson County Public Health. But
Nice to meet you. You have the cutest baby.
Oh, thank you. She's almost 2 months, so
congrats.
easing back in from maternity leave. So I've been kind of MIA since the middle of September. So I apologize for popping in. Yeah, Barb actually did ask for the Quilcene Brennan Empowered Teens Coalition to help out with some of that recruiting for community leaders as well. They're getting ready to prep for the whole community health assessment down there. And then I can actually see if Barb has some people that she'd be willing to refer to, or even bring flyers if we wanted to begin recruiting for people to share.
That sounds great. Thank you, Dunya.
It's a great idea. I had one more topic since two people are here who I sent an email to, Anya and Gabby. I just want to make sure from the Behavioral Health Summit, so right, the pre-hospital oriented meeting, we were trying to build a 2 paragraphs. One is sort of information for pre-hospital providers, law enforcement, EMS, about who to contact for non-crisis behavioral health patients. And so like a blurb about, contact info for your team, what your team's mission is, kind of what you do. And so Gabby, I think that would be both for your outreach stuff in South County as well as the lead, as well as CARES, or delegate that to someone for CARES. And then Anya, for your public health outreach stuff that you do. So, and basically the idea is that there'd be sort of that way when people are out in the field. I think there's still confusion about what team to call for what, and how to access. And so a card that we could give to, or information we could give to the pre-hospital providers so that they would know, oh, this is a real case, or oh, this I should call this person, or this I should call this person, emphasizing that crisis always still goes through the VOA for the DCRs or a mobile crisis outreach team. And then a second, I talked to Barb from Public Health about what we all call the yellow card, which is the community resource card. And it sounds like next revision, it's undergoing some revision, next one hopefully published in January. And she was happy to have you all put whatever information you want to go on that card. And I can collect that and give that to her. So I just want to check in and make sure there weren't questions or concerns, or if my very draft document I sent made sense.
I can get back to you. I don't have any questions. I think it just got bogged down in my inbox.
Cool.
Yeah.
Dr. Carbon, when you are doing that draft, actually, I was just recently spoken to 2 different outpatient clinic providers, and both of them said, I don't know who I can access, who I can call directly. And so just maybe a sentence on the card itself, but then also when we distribute them, maybe even going around to a staff meeting and saying, here they are, and you guys can, you can do all of this or whatever.
That's a great idea. No, I always forget about our primary care providers who are both at Jefferson Healthcare and some at Discovery Behavioral Healthcare, providing all that great care. So that's a great idea. And I think this would be oriented towards that. Like, I have someone with this challenge and I need help with this. Who do I call? Like we learned, was it yesterday? I don't know, whenever this week, I've learned from Gabby about some cool website for transportation. If some elder needs a ride somewhere, how to do that. So I think there's lots of resources, and just trying to get them in one spot so that you can access them easily.
Good ideas. Okay, thank you, everybody. Have a great weekend and Thanksgiving, and I'll look forward to being in touch with you all later.
Thank you.
Thank
Bye.
you.